As we've been reporting, President Trump announced today a deal with Eli Lilly and Novo Nordisk to lower the cost of their weight loss drugs for some Americans. Without insurance, the price of these injectable medications, also known as GLP-1s, can reach up to more than $1,300 a month. But under the president's plan, Wegovy's lowest dose would start at $245 a month. Zepbound's lowest dose would start at $149 a month. For more, let's bring in Dr. Holly Lofton. She's the director at New York University's Langone Medical Weight Management Program. Doctor, thank you for being here. What does increasing access to these weight loss drugs mean for public health and obesity rates in the U.S.?
Thank you for having me. Right now, we're in a situation where patients are either having to self-pay those high numbers that you just quoted for these medications, or they're using their private insurance. However, Medicare and Medicaid patients who utilize those resources don't have access to these medications that have $1,000 price points. So getting these numbers down to the hundreds can really help 35 to 60 million beneficiaries of Medicare and Medicaid have access to these important drugs that not only help with weight management, but also improve other conditions such as heart disease.
I mean, you touched on it. What's the 30,000-foot view of what this looks like for public health? Because we know a lot of people, they try and diet, they try and exercise, and those things just simply aren't enough.
Well, we know that in trials where we look at the efficacy of these medications, there's always a placebo group, and that group is doing diet and exercise. They usually lose about 3% of their weight, which is negligible, and over time, that really doesn't lead to a decrease in mortality or morbidity risk or disease risk. So improving access to these medications can help us further cut downstream Medicare and Medicaid costs for things like cardiac admissions and severe heart conditions admissions, such as heart failure, severe diabetes, and other medications uses that we are using right now. We may not need as much of them as we have access to the GLP-1s for our people who have Medicare and Medicaid.
Do you know why those government health programs have been so restrictive in the past when it comes to these drugs?
Well, there is actually a law that stems back from the 90s when there were medications which weren't as safe for weight loss that actually did cause valvulopathy, which is a heart valve disease. So there was a law made for any CMS beneficiaries that they will not cover weight loss drugs. Now, we know that the GLP-1 agonists are more than weight loss drugs. They don't solely suppress appetite. They help fat cells shrink. They really go to the core of the brain and gut pathway to get us to lose weight, but also decrease risk of heart disease, sleep apnea, other conditions such as fatty liver. So we are seeing these medications being safe and effective for long-term use in trials and in the general population.
Dr. Holly Lofton, thank you.